A 72-year-old patient presents with sudden onset of the worst headache of my life. A non-contrast CT head is negative for hemorrhage, but suspicion remains high. What is the next best step? A. Repeat CT in 24 hours. B. Lumbar puncture, LP. C. Start 4 heparin. D. Magnetic resonance imaging, MRI. Answer: B. Lumbar puncture, LP. Explanation: in cases of suspected subarachnoid hemorrhage, SAH, where the CT is negative, which can happen in 2 to 5% of cases, an LP is mandatory to look for xanthochromia, yellow discoloration of CSF from hemoglobin breakdown. Which of the following is the most common cause of an embolic stroke in the elderly? A. Carotid artery dissection. B. Atrial fibrillation. C. Patent foramen ovale, PFO. D. Infective endocarditis. Answer: B. Atrial fibrillation. Explanation: atrial fibrillation leads to blood stasis in the left atrial appendage, forming clots that can embolize to the brain. This is why anticoagulation is prioritized in patients with high CHA2DS2-VASc scores. A patient presents with a blown pupil, fixed and dilated, and contralateral hemiparesis. This clinical picture is most suggestive of which type of brain herniation? A. Subfalcine herniation. B. Tonsillar herniation. C. Uncal, transdentorial, herniation. D. Upward cerebellar herniation. Answer: C. Uncal, transdentorial, herniation. Explanation: in uncal herniation, the medial temporal lobe, uncus, compresses the ipsilateral CN3, causing the blown pupil, and the ipsilateral cerebral peduncle, causing contralateral weakness. What is the classic clinical triad seen in normal pressure hydrocephalus, NPH? A. Headache, vomiting, papilledema. B. Fever, nuchal rigidity, photophobia. C. Urinary incontinence, gait instability, cognitive decline. D. Tremor, rigidity, bradykinesia. Answer: C. Urinary incontinence, gait instability, cognitive decline. Explanation: often remembered as wet, wobbly, and wacky, NPH is a reversible cause of dementia that can be treated with a ventriculoperitoneal shunt. Which medication is the first-line treatment for a patient in status epilepticus? A. Phenytoin. B. Valproic acid. C. Lorazepam. D. Levetiracetam. Answer: C. Lorazepam. Explanation: benzodiazepines, like lorazepam or midazolam, are the immediate first-line agents to stop seizure activity. Long-acting antiepileptics, like phenytoin, are given subsequently to prevent recurrence. A patient presents with ascending muscle weakness and absent deep tendon reflexes following a recent diarrheal illness. What is the most likely diagnosis? A. Myasthenia gravis. B. Guillain-Barré syndrome, GBS. C. Multiple sclerosis. D. Amyotrophic lateral sclerosis, ALS. Answer: B. Guillain-Barré syndrome, GBS. Explanation: GBS is an acute inflammatory demyelinating polyradiculoneuropathy often triggered by Campylobacter jejuni. The classic ascending pattern and areflexia are hallmark signs. In a patient with an acute ischemic stroke, what is the golden window for the administration of intravenous alteplase, TPA, from the time of symptom onset? A. 0 to 1 hour. B. 0 to 4.5 hours. C. 0 to 12 hours. D. 0 to 24 hours. Answer: B. 0 to 4.5 hours. Explanation: for most patients, 4.5 hours is the standard limit for fourth thrombolysis. Beyond this, the risk of symptomatic intracranial hemorrhage often outweighs the benefit, unless mechanical thrombectomy is indicated. Which neurotransmitter is primarily deficient in patients with Parkinson's disease? A. Acetylcholine. B. Serotonin. C. Dopamine. D. GABA. Answer: C. Dopamine. Explanation: Parkinson's involves the loss of dopaminergic neurons in the substantia nigra pars compacta, leading to the classic motor symptoms of tremor and rigidity. Myasthenic crisis is primarily characterized by which of the following life-threatening complications? A. Severe hypertension. B. Respiratory failure due to diaphragm weakness. C. Status epilepticus. D. Acute liver failure. Answer: B. Respiratory failure due to diaphragm weakness. Explanation: in myasthenia gravis, antibodies against acetylcholine receptors cause muscle fatigue. A crisis occurs when respiratory muscles become too weak to maintain ventilation, requiring intubation. What is the target mean arterial pressure, MAP, often recommended in the management of acute spinal cord injury to maintain cord perfusion? A. 65 mm of mercury. B. 75 mm of mercury. C. 85 to 90 mm of mercury. D. 110 to 120 mm of mercury. Answer: C. 85 to 90 mm of mercury. Explanation: current guidelines for acute spinal cord injury suggest maintaining a MAP between 85 and 90 mm of mercury for the first 5 to 7 days to prevent secondary ischemia to the injured cord.